Alrighty, so I am going to be doing some med administration. So I am in our med room right now, gathering up all of my medications that are due for my patient at this time. So I have my patient's MAR. I'm making sure I have the correct patient, going through all of the right medications, the right dosages of them, making sure they are the right route, and we're administering them at the correct time. I've made sure that my patient is not allergic to any of my medications, and there are no interactions with between any of the medications that we're going to be giving right now. So we're going to be giving 4 different medications. Our first medication that is ordered is a nitroglycerin patch for 0.3 milligrams per hour being administered. So I have that right here, making sure I have the right dosage. And then we also have Keflex, which is an antibiotic, and the dosage for that is 250 milligrams, which I have here. So I have that with my water. And then we have insulin ordered, which is on a sliding scale, and we've already checked the patient's blood glucose level, and based on their blood glucose, we're going to be giving 10 units of regular insulin. So I'm going to clean at the top of these for 30 seconds for the sake of time. Clean this one as well for 30 seconds and allow them to dry completely. So for 10 units, I'm going to draw up 10 air. And I'll draw up a little bit extra so that I can get rid of any air bubbles.
Okay, I can do that. You can watch that is locked low. My patient has their call light. You let me know if you need anything, okay? I'll see you back here in a couple hours to give you your meds again. Okay, and then I will go and record everything in the MAR.
That is 10 units. And I'm going to label this, making sure that we can still see the amount of medication that we're giving. So I have this labeled with the medication, the dosage, the patient's name and date of birth, and my initials with the date and time on there. And then that's our insulin. Then we also have Ketorolac ordered, which is a pain medication. So we're going to draw up, we have Ketorolac 15 milligrams ordered. So we're going to draw that up. I already cleaned the vial. I'm going to attach my blunt needle here. And this is 15 milligrams per mil. So we're going to be administering 1 milliliter. Draw up a little extra. Put that into space. Out a little extra so that I can get rid of any air bubbles.
Thank you so much. And I repackaged everything.
Oh, perfect.
Thank you.
Are you guys leaving?
And we are going to label this one with the medication name, dosage, the patient's name and their date of birth, as well as my initials, date and time. So our nitroglycerin patch, some adverse reactions with that could be syncope, hypotension, tachycardia, or nausea and vomiting. So we would want to assess our patient's vital signs before we give this medication to make sure that they aren't already hypotensive or tachycardic. We're going to assess their skin, make sure we remove the previous patch that was on there, and clean the site, also rotating administration sites. Some overdose symptoms that could occur is bradycardia, vision changes, severe nausea and vomiting, and some sweating and cold, clammy skin. And then for our insulin, our patient has diabetes, so this is why they are getting insulin. Some adverse effects for insulin would be hypoglycemia, hypokalemia, or weight gain. So we would assess their blood glucose levels. Also, we could do a neuro assessment to make sure they are neurologically intact. So when we administer the insulin, we would want to rotate their injection sites as well to decrease any bruising or anything like that. We would also administer this about 30 minutes before any meal times. And then some overdose symptoms of insulin would be sweating, shakiness, decreased level of consciousness, or tachycardia. So we would monitor for their hypoglycemia. If we needed to do an intervention for that, we would administer some glucose for our patient. Our ketorolac that we are giving is an NSAID. This treats moderate to severe acute pain. So this is in order for it to be given once. We don't want to give this long term because it can cause some cardiac issues, but also GI bleeds, which is an adverse effect of this medication. It can cause headache, indigestion, nausea. We would assess our patient's pain scale before and after administering this medication. This medication places the patient at a higher risk for blood clots and GI bleeds. So we would want to monitor for those things closely. Our last medication is Keflex, and this is the antibiotic. Adverse effects of this would be abdominal pain, anemia, angioedema, diarrhea, or dizziness. We would do a respiratory assessment because he is taking this for pneumonia, so we would do that. And we would educate the patient on the importance of taking the full prescription of this medication that the provider has prescribed, even if the patient is feeling better. And then some overdose symptoms would be vomiting, severe vomiting, seizures, or hematuria. Some safety things that we would want to consider with this medication is some high doses can cause central nervous system toxicity. Also, prolonged use of this antibiotic could cause super infections. Before we go into our patient's room, I am going to change out my blunt needle. I do not do that. Now we're ready to go into our patient's room. All right. So we would knock. Hi there. My name is Liz. I've got a couple of your medications here for you. can you confirm your first and last name and date of birth for me? Perfect. So I have my right patient. I am going to raise the bed up for myself. Stuart, do you know what your medications are today that I've got for you? Awesome. I'm going to perform hand hygiene and some gloves on. So, Stuart, I've got your Keflex today, which is your antibiotic that you're taking for your pneumonia. I've also got your insulin for your diabetes and this nitroglycerin patch for your chest pain. And I've got Ketorolac also for some of your other pain that you were having.
You don't have to pay.
Okay, so we'll start out with your Keflex.
You go to the polls.
I've got water here. So you swallow this and take a sip of water. Awesome. And the patient tolerated that PO med well. Next, I'm going to administer our nitroglycerin patch. So I've made sure to remove the previous patch, and we're going to alternate sites. So we're going to do it here. My site is clean and dry and free of hair. I'm going to remove the patch. I would date, time, and initial the patch, and then administer the patch. And kind of hold it on there to make sure it's sticking well.
Thank you.
Okay, next we're going to administer your insulin. So we're going to do this here in your abdomen. And you got it in this site first or last time, so we're going to do it over here. I'm going to clean the injection site and allow that to dry completely before administering our insulin. I'm going to pinch and pinch, going at a 45-degree angle. And then I would put this in the sharps container, but for us, we are recapping. Okay, next we're going to do our IM injection for your Ketorolac. So there are 3 different sites I could do an IM injection. The first would be the deltoid here. So I would find the acromion process and 2 fingers and go there central to the deltoid muscle. The next site that I could administer an IM injection would be here at the ventrogluteal site. I would put the heel of my hand on the head of the femur, and spread my fingers out with my thumb pointing towards the belly button there, and kind of go right in between the V there, in that squishy spot. The site that I will be using for my IM injection would be here at the leg. I'm going to put my hand above the knee here and find the head of my femur again. I will go to the center of the center right there. So I'm going to clean my spot. Right there. And let that dry completely. And we're going to do the Z-track method. So I'm going to pull the skin and inject, stabilize, and inject our medication, pull out and release the skin. And I would safety this needle, but I'm going to recap it. Okey-dokey. Then I would put all my sharps in my sharps container and clean my tray off here. Make sure our patient is comfortable. Do you need anything before I leave? Awesome. Make sure that they have their call light. Remove my gloves and perform hand hygiene. And then make sure our patient is low and locked. And then I would go and document in the MAR that all of my meds were given and tolerated well.